My name is Dan Coleman. I'm a postdoctoral research fellow at Birmingham University. The project that I've been awarded the John Goldman Fellowship for is looking at the role of RAS in acute myeloid leukemia, in adult acute myeloid leukemia specifically. Acute myeloid leukemia is a very aggressive disease and is the most common blood cancer in adults. As patients who get the disease are often elderly, they're not suitable for the intensive chemotherapy that's needed to achieve remission. So we're looking at targeting the signaling protein RAS, which when activated by mutations or mutated itself, leads to increased growth in the cancer cells. So by inhibiting that family of proteins, we're hoping to reduce cancer growth, and this will give clinicians a tool to use in the clinic, which will hopefully increase the treatment options for these elderly patients. I'm most interested in adult leukemia because whilst paediatric leukemia is now very treatable, adult leukemia still has a very high mortality rate. I became interested in leukemia mainly because of the history of it. So back in the 60s, particularly paediatric leukemia only had a cure rate of about 10%. And over the course of sort of 40 years up to the 90s, sort of early 2000s, that was improved to a cure rate, a 5-year survival rate of almost 90%. And that was all done by research into different combination therapies and into different targeted therapies over that time period. The area was kind of attractive to me because you can see the effect of research on clinical results in leukemia. The John Goldman Fellowship is going to allow me to kind of make the step from being a postdoc working under different scientists to achieving my independence in research. So I'll be able to generate data over the course of this project with the aim of using this data to support future fellowship applications for larger grants, which will hopefully allow me to become a leader in leukemia in this country. I think Leukaemia UK certainly are one of the few charities that offer funding for sort of this stage of my career, which was very appreciated. I think in 10 years I'd want to have kind of my own lab group set up and hopefully close ties to a nearby hospital in order to be able to have access to samples from NHS patients, which have been really important to the work that we've been doing in Birmingham.